Hello, everyone, and welcome to this ThinkIn with Jeremy Hunt. I'm James Harding. I'm the editor and co-founder of Tortoise. And Jeremy, if you've been to a ThinkIn before, you'll know that I can, on occasion, give a really embarrassing, toe-curling introduction to the person that's joined us. This evening, I should say a particular thank you to you, not least because you're joining us, and I understand just a few days ago you got COVID. So, you know, you had the best excuse around to get out of it. I really appreciate you making the time. How are you feeling?
Thanks. I'm much better today, actually. I got the diagnosis 6 days ago, and symptoms have been fairly mild. The first day I did wake up with like the closest I've been for a very long time to a horrible teenage hangover. But it's thankfully it's moved on now. So we'll be fine this evening. But I will use it, of course, as an excuse if the questions turn all BBC and not Tortoise, but I'm sure you won't do that.
And Jeremy, you got it just after having had the vaccine, is that right?
Yeah, I had the vaccine about 3 days before I think I picked it up, and so the antibodies had a bit of time to build up, but not quite enough. You know, I think it's this new Kent variant I've got, probably because I've been pretty careful. But it just is so contagious. I think you can pick it up anywhere. So just have to be really, really careful.
All right. Well, this is already different from your standard interview, because I can't remember a time where it starts off with people messaging in the chat, "Get well soon." So,
Okay.
so I'm sure you can't either.
Gosh, you're so nice at talking.
So, by the way, hold on. I think maybe a little premature. Jeremy, the way this works is, you know, the ThinkIn was intended to be like an open news meeting, and so I've got a bunch of questions, but a group of Tortoise members are going to come in. They'll have questions too and thoughts. In fact, our aim really is to try to come away with a better informed point of view. And the thing that we like about this is that we have some time. We have an hour to talk things over. And tonight in particular, what we really want to do is try and understand what we've learned in this year of the pandemic. It's almost exactly a year now that, you know, things really became clear to everyone. And I suppose, you know, I messaged you, you know, towards the end of last year saying, look, we at Tortoise were going to hold a COVID inquiry. Would you come and, you know, talk to us about it? And you said, look, rather awkwardly, you and Greg Clark had just announced that you were joining forces, your two select committees, to hold an inquiry. And I wonder whether we could start there, Jeremy, which is, having held a certain number of those sessions of the committee, do you now have a clear sense of what happened, why it is that the UK has had 126,000 people who've died?
I think I do, actually, although it is evolving, and you never stop learning on something like this. I mean, we've learned as a country some incredibly important lessons in the last year. I don't really know where to start, but you know, off the top of my head, in a pandemic, you have to act faster than the virus acts. And in the early stages, we weren't. We have to be better than we were in the early stages at learning from best practice in other countries like, you know, South Korea, Hong Kong, Taiwan, and so on. But at its best, British science is absolutely bloody brilliant. And when it came to the vaccines, we've seen that. So, you know, we've seen, I think, all our national virtues and our national flaws in full display over the last year. And I think it's been an emotional roller coaster for all of us, not just because of what we've been going through with the virus and the shock of that, but also because we're a country that has a certain self-esteem, and that's been on a roller coaster as well.
Could we take those elements separately, both the sort of the good and the bad? I suppose the Tortoise inquiry, if you came to a very kind of quick fire conclusion from the Tortoise inquiry, was that there were a set of mistakes that we as a country made that were rooted in optimism bias in our politics, that we were too slow to lock down, we didn't put enough into test and trace, we made a number of mistakes, not just right at the beginning, but time and again, that were around hoping things would be better than they were. You know, open borders, another example. And then there were a set of things where the virus exposed structural problems in the country, preconditions, if you like, and whether that was obesity or social care. And I just wondered whether we could do those things separately, Jeremy. Let's start with the politics, because I think people appreciate the sort of awkwardness of your position. You're there to scrutinise what the government does, but you're a Conservative member of Parliament. How do you judge the slowness of those political decisions and the mistakes that were made at a political level?
Well, curiously, James, it was actually pessimism bias, not optimism bias, that caused the scientific advice in the early days of the pandemic just to be wrong. And politicians have to take responsibility for all the decisions they take. But the advice at the early stages from SAGE was that this is a pandemic. In the end, we won't be able to stop as soon as there's community transmission. And the view was that around 60% of the population are likely to get it. And that's why we had that famous decision that was announced at a Downing Street press conference that we are stopping community testing on, I think, March the 9th or the 12th, something like that, which is an extraordinary decision when countries like South Korea, China, Taiwan believed you could control the transmission of this virus, and indeed were keeping transmission at levels well below 2-3% of the population at that stage. And so the reason for that was something for which I'm partially responsible too, which is that in the Western European and American scientific establishment, there was a kind of groupthink that pandemic equals flu, and that if we have a pandemic, it's likely to behave in the way that a flu pandemic behaves. And flu spreads like wildfire, and it is very much harder to stop, and it doesn't have such a long asymptomatic period where you can spread the infection without showing symptoms, and so testing is much less important. And across the whole of Western Europe and North America, there was this groupthink, which meant that we prepared very thoroughly, but we prepared for a flu pandemic. And in East Asia, where they'd had experience of SARS and MERS, they knew that this kind of virus could be controlled. And interestingly, Australia and New Zealand, which are culturally Western but geographically in Asia, went the Asian route. And the result is that they had much lower levels of death than us. So that, I think, was the main differentiator between the two. Whether you can replicate that going forward is much harder, because to keep COVID down to those kind of levels, you really have to keep your borders shut. And that's something that I think even in Australia and New Zealand, they will find very difficult going forward, which is why you then have to move to what the UK, I think, will be the first in the world to do, which is a vaccine-led strategy, which involves managing the risk of COVID rather than seeking to eliminate it altogether.
And how do you then explain, if you like, that pessimism on the part of scientists, saying this is a pandemic, our test and trace capabilities are not going to be sufficient, as you say, abandoning those plans on March the 12th this time last year, and then the delays to lockdown, not just in March, but again in September, and arguably again in November, December?
Well, this is where I think, one of the, by the way, I think British science has overall come out of this pandemic extremely well. Mm-hmm. So I think we have to recognize that the extraordinary genomic capacity that we've been building up in the UK, really since Sally Davis was Chief Medical Officer in the 100,000 Genome Project, the Oxford AstraZeneca vaccine. There's been a number of real triumphs, dexamethasone, the treatments for COVID, which nearly all come from the UK. So I think British science has overall had a very good war. But in this particular area, there was, again, at this time last year, there was a view that the British public would not want to be locked down for more than 6 weeks. After that, we'd stop following lockdown guidance. And therefore, it was really important to delay locking down for as late as possible, because if you lock down too early, then people might tire of it and start coming out of lockdown when the virus was at its peak, the very moment you wanted people to continue staying at home. And I mean, that was wrong. I think part of the reason why we made that mistake is because we were looking at China particularly, and we just discounted what was happening in China because it's a totalitarian society, and we thought that we really can't learn from them. But we didn't look at the East Asian democracies, Taiwan, Korea, which actually, Japan, these are very lively democracies. And they have the similar constraints that we have here, and they've taken a different approach. And so I think that is definitely something that we will need to be better at, being much quicker at learning from best practice in other countries wherever it happens.
And do you think, let's talk a little bit about those structural problems in British society and the health of the British people. When we first began to realise what the country faced in January and February, did you, as the former health secretary, the longest serving health secretary in the history of the country, think this is going to find the UK out in the way in which it's going to find few countries out because of issues of obesity, because of preconditions in the population?
No, I didn't. But for sure, we will conclude that, the UK and the US having two of the highest obesity levels in the developed world, in the world actually, will be a major reason why both those countries have had utterly appalling death rates. So there is definitely a connection, but I don't think we knew about that link this time a year ago. No, I think curiously, and of course this is something which feels extraordinary in retrospect, but the UK was rated as the second best prepared country in the world for preparedness for a pandemic by Johns Hopkins University. So the US university doing that, and they rated the US, by the way, as the best prepared country because we'd done incredibly detailed and thorough pandemic preparations. So I think that there's a very interesting point here, James. After Ebola, Bill Gates, who has turned out to be one of the greatest sort of John the Baptist prophets about the risks of global pandemics, Bill Gates, famously did a TED talk when he said, we've got to prepare for a global pandemic. And the thing we've got to be much better. He talked about two things in particular. Number one, we've got to get ourselves much quicker at developing vaccines. Well, that proved extremely prescient. And the second thing is we've got to be better at developing the health systems and infrastructure of poorer countries, because those are the areas where you could really see a global pandemic taking root. What Bill didn't talk about was actually rich countries need to look at their the weaknesses in their population health, at issues like obesity, poor housing, huge numbers of people living together in not very healthy conditions. These are also things that put a country at risk, and that's what us in the United States have learned, sadly, in a very big way.
Oh, Jeremy, have I just lost you?
No, I'm here.
Oh, no, you're there. Good. Sorry, I thought for a moment I had. Jeremy, I want to come to that point about what that tells us about our future health and, in fact, the future of the NHS. But I just want to reflect on the fact that someone listening to you tonight would say, actually, that is a very acute analysis of some of the things that led to the situation, the exceptional and performance of the UK in relation to the pandemic. And also, yes, I can see that. I can see that there was a pessimism that led to the cancellation of the testing program. I can see that we prepared, if you like, for the wrong pandemic, for flu. And I can see too that we had a suspicion about our willingness to undergo the same kind of lockdown as, China, South Korea, Singapore, etc. And I thought, yes, all of those things are true, but it's also quite a deft set explanation for the problems we've had without at any point identifying the role of the Prime Minister. And I just wondered what you think the role of the Prime Minister was in what happened to the UK last year.
Well, yes, I tried to do Boris's job, as you well know, James, and I have I do hesitate before making personal criticism, because, you know, I have thought very hard about what a difficult job that is. And, you know, it's something I've said before, but I'm sure that if I had been Prime Minister in that unlikely situation, I would have done things differently, but I'd also have made different mistakes. And it's the nature of that job that not only does everyone make mistakes, but those mistakes are subject to a massive amount of scrutiny. So I am nervous about sort of backseat driving on something like this. I think in Boris's case, it is very, very clear that in making the mistakes that were made this time last year, he was following scientific advice. I mean, we've now all seen the SAGE minutes, we pored over them. So I don't think you can fairly, and Boris is a very controversial politician, one of the most controversial prime ministers we've had for a long, long time because of the passions over Brexit. But I don't think you can fairly blame him for taking decisions where he was following scientific advice. I think it is also fair to say that he is a libertarian, and there was a natural hesitancy about taking measures that would take away people's liberties. But I don't think, I haven't found any evidence where scientists were saying, you've got to do this now, and Boris is saying, no, I want to do this in this first stage of the pandemic. I think there is an argument that perhaps in the September lockdown decisions, there was again a hesitancy because of his understandable libertarianism. I think what you have to say in his defense, though, is that I think the British public sensed that about Boris, that they had a prime minister who was incredibly reluctant to take away their liberties. And that is probably why we've had a high degree of consent to the lockdowns we've had, because they haven't felt that we've had a government that's been rushing to take away people's liberties.
But just if I understand that, your view is that the initial delays to the lockdown that were commented on, you know, by Neil Ferguson and others actually were in line with the scientific advice. The September delay was more of a political decision, sat more with Boris Johnson and arguably with Rishi Sunak too.
I think the scientists in September were clearly arguing for faster action than we actually got. But by, you know, again, probably only by a matter of a few days and around a week or something like that. But I think that's what the evidence seems to suggest. Certainly that's, but again, on the whole, even then, I think the government was acting in pretty much in lockstep with the scientific advice throughout this. So I think, you know, the question we have to ask ourselves is, why is it that advice, certainly in the first stage of the pandemic, was wrong? And one of the things that I think we should do, and certainly one thing that I think is likely to be one of our recommendations, is that SAGE, in a pandemic situation, automatically publishes its advice to ministers when it gives that advice to ministers. Now, why do I say
in real time? In real time.
Now, why do I say this is a very, you will understand this, James, but I might just spend a moment to explain why this is a very controversial thing to propose, because we have a very deep-seated tradition in British politics that official advice to ministers is not published. And the reason we have that is because we don't want officials to feel in any way compromised in giving totally frank advice to ministers, and we want them to be able to speak freely. And I think that's absolutely the right principle in normal times, that official advice to ministers needs to be kept private. In a pandemic, what was missing was any suggestion that we should follow South Korean test and trace. Wasn't modelled by SAGE until May. And I think if that had been published, it would have effectively been peer reviewed by all the other scientists in the country. There would have been a huge public debate. Why isn't SAGE telling us about South Korea? Why aren't they looking at more of a zero COVID approach? And that would have risen to the surface much more quickly. And I think that would have improved SAGE's advice. So in a pandemic, I think we ought to look at much quicker publication of scientific advice.
And quicker meaning simultaneous. You would say now that the advice that's going to the Prime Minister, to the Health Secretary, should be made available, that SAGE advice should be public.
Yeah, I mean, I don't mind if it's given 24 or 48 hours, but
Yes.
I think it needs to be almost immediate, because I think you want all the other scientists in the country to be able to look at it and debate it. And you want, we happen to have some of the best universities in the world, and it's a massive advantage to us as a country if the advice being given to ministers is being put through the ringer of all these other scientific establishments and people like Paul Nurse and Jeremy Farrar and all these people. Well, Jeremy Farrar isn't advised to the government. People like Paul Nurse and all the other people can look at this and give their comments.
Jeremy, I want to come back to SAGE and what you think of the job of scientists and NHS, but there have been a bunch of sort of thoughts and questions. First, I want to make sure that you also hear and sort of play back to you some of the views on your opinion on the, on the Prime Minister and others. But we started off where your very first comment was actually around testing. And, we're now sort of transformed by the politics of the vaccine. For much of the year, we were, essentially set by the politics of testing. And I see that Mehdi Askaria had a question about just the report that we saw last week around the apparent waste of money. Mehdi, I don't know whether you're there and you want to make this point to Jeremy.
Thanks, James. I think you've actually made my point. Your recent select committee report, Jeremy, actually picked the test, trace and isolate case. And I recall a figure of 37 billion pounds, which is spent or perhaps going to be spent over 2 years. But by all accounts, it's been an unmitigated failure. And this is not a partisan view. This is a common view. Just wondering, I'm sure you've contemplated on this, that who and how we can actually hold accountable for this, because we are not talking about chicken feeds here. We're talking about big money, and the decision making a person put at the helm with no obvious experience on a matter like this. How did that happen, Jeremy?
Well, I think it's, this is absolutely what happens in a democracy. I'm not sure this is exactly the right moment, because we're right in the middle of the pandemic for personal accountability. But Mehdi, can I tell you what I think happened with test and trace and why we had the problems that we had? Because I was one of the people who was, this time last year, advocating we need South Korean test and trace. What happened was it was then modelled in May, and Dido Harding was actually finally appointed, I think at the end of May. And by that time, our infection levels had risen to between 5,000 and 10,000 a day, whereas in Korea, they never got to more than 1,200 a day. So the job that test and trace had to do was much, much larger because of the time it took. Now, I think that was partly because of the delays that James was talking about just now. But what that meant was that when test and trace was set up, I think it's very clear that a locally organized contact tracing system would have worked better. I think we should have given that job to local authorities. They'd have done it better than these big national contracts. But in reality, by the time you got to the stage that we'd got to in May, we were so behind the curve that we had to get this thing up and running very quickly. And I don't think there was time to do that local route, which is more complex there. I think it might have been time if we'd started in January, but there wasn't. So we ended up almost having to do the centrally driven model. Now, when it comes to testing, which is the bulk of that 37 billion cost, actually the central model has probably proved its worth in the end, because we are now processing huge numbers of tests on some days, 1.5 million tests last week. So we are, to do that, I think you need some of these big central laboratories, what are called the lighthouse laboratories. You know, they had a more localized system in South Korea, but they never had the volume of tests to process that we've had to. When it comes to contact tracing, it was clearly the wrong approach, and we should have gone local, but we were just too late. So that's what I think actually happened. Where we are now, I think test and trace is actually much better than it's given credit for right now. I used it myself last week. I've been contacted regularly by the people in NHS test and trace. They've, you know, on the whole been pretty good. But I think the lesson is that contact tracing is far more effective when it's organized by people who know the area. The big gap is that we still, I think the latest figure I saw is that a fifth of the people who are asked to isolate don't fully isolate. So we're now got about 5,000 infections a day. That means about 1,000 people a day, new people every day. So it's a cumulative number, are being asked to isolate because they were near someone who had COVID and are not doing so. Some of them still going to work. And, you know, 1,000 people a day is potentially enough to restart a pandemic. So that I think is one of the biggest weaknesses in our armory at the moment.
And Jeremy, what do you say to people who say, you know, the Tories now are going to get a reputation or having a reputation for being wasteful and incompetent, right? Wasteful because quite so many billions of pounds have gone missing. And it's not just PPE contracts or, you know, bounce back loans, but test and trace. And incompetent because precisely the point that you were making months ago, which is even if you're doing the testing, and even if you're doing the tracing, you're not providing people the financial support to make sure that they isolate. So this system's not working. How can or should the government answer that?
Well, I think the politics of a pandemic are different. And I think the public understand that you can't look at sums of money in the same way when you have an extreme event like a pandemic. I mean, I remember the story that Margaret Thatcher, when she embarked on the Falklands War, was given advice by one of her closest advisors who said, at the key committees, do not invite the Chancellor. And she didn't, because basically this is a war and you've got to win it. And this is not a time when you want to have arguments about money. And for sure, there was money wasted. But, you know, we were in a hell of a hurry to try and deal with the problems in PPE provision, which was an emergency. And, you know, we had to get this thing up and running really quickly. And I think people do understand in a pandemic. So when it comes to the general charge sheet for the government, I think people will say, we've got some things, well, governments all over the world are being held to account by their electorate for doing some things right and some things wrong. And that's happening in Germany, which had a good start to the pandemic, but it's going through a miserable period now with the vaccines. It's happening in Japan, which had a bad start with a cruise ship. Then they did very well. Now they're getting a lot of grief because of the Olympics. What's interesting about this country is that we didn't just do some things well and some things badly. We did some things spectacularly well and some things spectacularly badly. So there was a kind of, we had the extremes in this country. But I don't think people are going to politically hold the government to account in quite the way you suggest, because I think they recognize that we did do some things very well, even though we did some things very badly.
Jeremy, what I'm going to do, because there are, I mean, you won't have seen there's been just a cascade of people having really interesting things to say in the chat. I want to just bring in a few. Isabel Hilton made a comment about the style and behavior of the Prime Minister. So I'd like to bring in Isabel Hilton. I just saw Mary Rivers make a point about NHS pay, which is obviously a live issue. And given your point about the Chancellor, I would be useful to hear from her. I'm going to bring them in right now. Isabel, do you want to make your point?
Thanks, James. Apart from really being quite appalled that you didn't think to look at Taiwan and South Korea at the beginning, because they had this experience of SARS, which is a coronavirus, which might have spared us preparing for the wrong or dealing with the wrong virus. They had extremely effective systems which were, you know, there to be studied. But Also, when you say, and Boris has said recently that he was let down by the scientists, I do not recall any scientist advising Boris to visit a hospital without a mask and shake hands with everybody and boast about it. You know, there are, it's fine to, you know, kind of complain about the scientists letting down the politicians, but the politicians' judgment also has to be called into question, surely.
Well, I agree with you. We should have, that's my point, and I was saying it the whole way through, we should have been quicker to learn from what was happening in Taiwan and South Korea, and those other countries that had that direct experience of SARS and MERS. I think what is fascinating, if you look at, I mean, the scientific advice from SAGE was not right at the early stage of the pandemic. I think that is just factually true. I think people like Neil Ferguson have said as much. What is interesting, though, is that when it comes to vaccines, we didn't prepare for the wrong pandemic. Actually, we got it absolutely right. In my time, when we had the Ebola pandemic, we took on board what Bill Gates said about the need to reduce the time to develop vaccines. Chris Whitty, who interestingly at that time was chief scientist at DFID, so he was closely involved in the Ebola response, set up the UK vaccines network, and funding was put in to find a vaccine for MERS, the Middle East respiratory virus, which became the foundation for the AstraZeneca vaccine that we ended up with. So what you see is that we did actually learn some really important lessons from those other respiratory viruses in the area of vaccines, but not in terms of the way that we respond to a pandemic. And I think that's why forming an overall assessment of our national response is such a curate's egg.
Jeremy, thank you. And I want to come to the nurses' pay offer, 1%. Mary Rivers made the point in the light of your comment, Jeremy, around, you know, not inviting the Chancellor to these meetings. Mary, are you there?
Yeah, I'm here.
Do you want to put your point to Jeremy Hunt?
Well, yes, obscene amounts have been spent on consultants during this pandemic, and yeah, there are nurses going to food banks, and this derisory 1% means that actually it's a pay cut in real terms. Recruitment is at an all-time low. Nurses are exhausted and going to leave the NHS. So this is no time to be mean to the people on the front line who've been doing the hard work.
I agree with that, and I can't believe the government looks back on the decision to do the 1% as being the right thing. This is a kind of situation where I think the sensible way through this would have been to say, you know, we will listen to what the pay review body says and we'll accept what they say because they're an independent pay review body. Now, normally in these situations, in normal times, the government doesn't say in advance that it will accept an independent recommendation because it wants to reserve its right to accept or decline a recommendation when they see what it is. But this is a pandemic, and I think the nurses just need to know that they're going to be fairly done by. So I think that would have been a better approach.
Can I just ask you about that, which is a fundamental question about conservatism in the 2020s. And I know that what happens in Westminster, and you'll know it very well, which is that often when there's a sort of new politician on the block and there seemed to be someone who's doing well and going places, they get a certain following wind. And you would have to say that's been true for Rishi Sunak in the last year. And yet there is a fundamental choice that he's made at the last budget, and arguably that he's made in so many of these financial interventions, which is to try to deliver a message that he's going to be there and do whatever it takes, but also keep an eye on financial discipline and, if you like, his own reputation for prudence with the public finances. And I just wondered whether or not you think this is, as kind of sensible and orthodox as that might be in conservative circles, a fundamental mistake. Because, as you say, the pandemic is different, the circumstances are different. It's time for a different approach to spending and borrowing, at least for the next few years.
I look at that budget differently, James. So I do think that we should have done the nurses' pay issue differently. I was very disappointed that there was no talk about a long-term plan for the social care system in the budget, and I've said so. I think it's a terrible thing that we have had a 10-year plan for the NHS for 2 years now, and we still don't have one for the social care system, when we've seen in the last year just how incredible the sacrifices made by frontline care workers have been, every bit as important as frontline NHS workers. So I have my beef with elements of the budget, but if Rishi had wanted to be popular, he would have ducked all the difficult decisions. But the most important thing that a chancellor has to do in a budget is tell people the truth about our money, and to try to pretend to us that there is a future for this country where we don't actually balance our books and spend the money that we're generating would have been a terrible deceit. So he had to start somewhere with that very difficult message. And I think it is the right message. I don't in the end think, I don't want to go into the sort of whole arguments about austerity. He's not, I don't think, going back to austerity, but let me put it this way. If there is one lesson that over the last 20, 30 years that is really important, is that you have chancellors who build up reserves for a rainy day, whenever that may come. And so I think he was making that point, that we are not going to be able to carry on spending in the way we've been doing. So I think it was a difficult tightrope. I don't think he got it, as I say, exactly right in every way, but I think he was trying to do the right thing.
It's interesting. I mean, I think and worry that we as a country are not having the debate about what a higher level of debt at these historically very low costs of debt repayment would enable us to do about dealing with the structural inequalities and the public service delivery problems that have been revealed in the last year. And it feels as though that debate's not really engaged, but that may be for another discussion, and maybe for one with Rishi Sunak.
I'll just say before you go on, James, I'm not sure the government has really declared its hand in that respect, because I think this is going to be a high spending government, big state conservative government. I don't think in saying that we have to balance the books, he was not saying that he wants to return to 1980s small state Thatcherism. He was just simply saying that what gets spent has to be generated.
Yeah. But I want to talk a bit about the future of the NHS and the future of social care, Jeremy. And I see Simon Harrod has made some points about actually what life's been like inside British hospitals. I'm interested to know. First, I'm interested to know what you see in terms of everyone's applauded the NHS, and understandably the courage and perseverance of people working there, but it's also exposed things about the huge variety in outcomes depending on where you go to hospital, the kind of service you receive, and also the future impact, how long a hangover, how big a shadow this casts. I don't know whether, Simon, you're there to give a sense of how you see things and what the future challenge for the NHS might look like.
Yeah, I suppose I can give an idea. I'm actually a medical director at a big London hospital in the East End, and my worry now is not COVID, it's catching up. We've spent the last year having to redeploy hundreds of staff from their normal duties to man our critical care, which expanded from 44 beds to 150 beds in that last pandemic. So we now have waiting lists stretching unbelievably high. I mean, the numbers just a shock when we actually look at them in all the meetings we go to. So we've got to play catch up. And I think part of that catch up will actually probably be re-educating the population, not to have such high expectations. There has been a tendency for people to assume if they came to hospital, they'll be offered some form of procedure, which may or may not have been benefits. So I think we're going to have to readjust people's attitudes to what's actually going to be available. But of course, my other worry is the clinical harm we're causing for those people who actually do need some of these treatments. I was reassured at the end of the first pandemic, I did some clinical harm reviews. In fact, the clinical harm actually was not as bad as I thought it was going to be, despite people not attending hospitals. So I'm hoping that may still be the case. The other thing is, out of all these things, some positive things have happened to the NHS. We've revolutionized the way we do outpatients. We've stopped dragging people up to see a doctor for half an hour on long periods and do it virtually now, and that's worked very well. So we've accelerated some of these things very quickly. Some things which have taken the NHS 4 or 5 years to do with lots of paperwork and bureaucracy, we've done very quickly. So to be fair, there have been some benefits to this, although completely outweighed by where we are at the moment with our waiting list.
So, Simon, thank you. Jeremy.
Well, Simon, first of all, thank you to you and your colleagues for everything that you've been doing under such pressure. I thought about this very hard because I have the benefit of not being health secretary now and being able to stand back a bit. And it seems to me that this is the biggest shock the NHS has had in its history. And those who are responsible for the NHS, which is a Conservative government now, need to do exactly what you've been talking about, which is to step back and say, what is it that we can learn from this? And what is it that we need to do now, having had this almighty shock, to really set the NHS up for the 21st century? And could we turn this into a 1948 moment? The NHS was founded in 1948, a really big moment of change where we resolve some of the long-standing issues. And I think the British people, we know they love the NHS, but they want the NHS to be the safest, best, highest quality healthcare system in the world. And we all know there are lots of things that need to happen if we're going to deliver that. I think we can deliver it, but I'll give you 3 things that I think we need to do if we want this to be a 1948 moment. First of all, we've got to be better. We've got to sort out our long-term workforce planning. We still don't know if the NHS is training enough doctors and nurses for the future, because the government won't publish NHS England's long-term workforce projections for the number of doctors we're going to need in 10 years or 20 years' time, because this is still ends up being haggling between the Treasury and the Department of Health in the run-up to a spending review. And this is completely ridiculous because it takes 7 years to train a doctor, 3 years to train a nurse. And if you don't train enough, you just end up spending much, much more on locum doctors and agency nurses. And we need to have a proper way of having independent workforce projections, a discipline on the system, a bit like the OBR has been a discipline on the Treasury, to make sure we do that. That would be one. The second thing is we've got to sort out the social care system, which I'm sure James is going to come on to, because it works in lockstep with the NHS. And the third one is we have got to really be honest where our quality is not the best in Europe, best in the world, things like our cancer survival rates, which still lag France and Germany. And we've got to be absolutely, utterly determined to put in place a plan that makes sure that we do have the best cancer treatment anywhere. We can totally do this with the will, but those are the 3 things that I think would really set the NHS up for the future.
Jeremy, can I just say, I mean, anyone listening will observe how sort of remarkable it is that some of the most striking things you're saying are, we should publish scientific advice in real time. We should make sure the government publishes, what it needs in terms of long-term workforce planning, and we need to have honesty about, quality of care for certain illnesses. On that third one, when you say you want honesty, what does that mean in practical terms? Presumably those tables of comparative outcomes are available.
Yeah, I think so. When I was health secretary, I spent a lot of time working on transparency. I introduced Ofsted rating for hospitals, GP surgeries, and so I think the NHS is massively better than it ever has been about being honest about where there are problems in poor care, which is a very positive step forward. But the next step is to really do something about it when you have areas where there is a pronounced difficulty. So I think the areas where I would say at the moment we are under the severest pressure in the NHS, not the social care system, would be cancer care, where we still lag countries like France and Germany, and we shouldn't. Mental health, where actually our care is pretty good compared to those other countries, but there is still massively more demand than there is supply of services, because the whole world is waking up to the power of effective mental health treatment. And then I think general practice and primary care is under severe pressure, and we really need to do something to improve the capacity there.
And can I just ask, just touching on the mental health question, and I suppose cancer care too. Many people listening here, and you'll have seen in the chat too, if you're watching Jeremy, saying, well, this is all a bit rich coming from you. You were party to that government of austerity, to those cuts. And then I've also seen the coverage where you say, well, actually, I was also the Secretary of State for Health who made the case for the £20 billion increase in spending. What I want to know is, even the 20 billion, was that really close to sufficient for dealing with the kinds of step changes in mental health care or cancer care provision that you're saying is needed?
I think it might be. I mean, £20 billion, which is about the last thing I negotiated as health secretary, is about 1% of GDP. So it was a very, and you know, that sort of starts to take us up to the same levels of GDP that Germany is spending, and not quite as high as France. It's a very significant change, although it happens over 5 years. It wasn't an instant increase. But your point about mental health is really, really significant. So I put in place some big plans to expand mental health provision. If I take one area which is children and young people's mental health, I launched a green paper, which involves having a mental health lead in every secondary school, massive expansion in provision of mental health services. But to deliver that, we need to employ 8,000 more people, specialists. Now, CAMS, the mental health service, only employs 9,000 at the moment. Right. So in order to deliver this change, you've got to double the mental health workforce. And that is, a number of those people will be clinicians. They'll all need training. So that doesn't happen overnight. And that's why I think that to get health policy right, you have to think about the big rate limiting factor, which is the supply of trained clinicians. And that has to be front and central of every policy change, which is why I made workforce, grown-up workforce planning, one of the central things that I want us to sort out in this, post-COVID refresh for the NHS.
So we said we'd get to social care. For a lot of us, Jeremy, we just don't understand how it's possible that everyone can talk about it and nothing happens. So rather than make the case for it happening, will you just explain to us why the politics prevents any progress on this?
I think what happens, very sadly, is that when resources are short and there's a competition for resources in a spending review context, the Treasury says, well, we're either going to give this money to the NHS or to social care, but we can't do both. And usually, because the NHS is so much more politically salient, it ends up winning. And that, is an enormous failure to understand how these two systems are totally interlinked. If you have a 90-year-old lady in the early stages of dementia living on her own at home, and you don't look after her effectively, she'll dial 999 and she'll end up in an A&E and in a hospital where she'll probably be there for some time, because the hospital won't want to discharge her until they know that she can be well looked after, which is why I think the only real answer is to take this. I pushed for a 10-year plan for the NHS, which it hadn't had before, because of the fact that it takes so long to train doctors and nurses. I thought you cannot do healthcare properly unless you're taking a long-term horizon. We need exactly the same for the social care system.
And do you think, Jeremy, that the experience of the pandemic will have changed the politics of this? Because your point is that the salience of the NHS means that always wins out in the budget war. Is it possible now that changes?
It's possible. I think if, frankly, I'm a natural optimist, but let me just put a pessimistic spin on this. If we don't sort out social care this year, the year after, the whole country has seen how bloody brilliant our frontline care workers are, then really we are never going to do it. And look, I know how tough national finances are. And I think we have to be honest that the two countries that have made the best stab at sorting out their social care systems are Japan and Germany. And both of them have done it by introducing a new tax one way or another paid by older people. And I think we have to be honest. If we want to, well, the countries that don't seem to have a huge problem with social care are some of the Mediterranean countries like Italy and Spain. They don't spend very much, but that is because there's an assumption that older people will live with their families. Mm-hmm. Although that's very wonderful for the older people, the price those countries pay is much lower female participation rates in the workforce, which I don't think is a price we'd be willing to pay in this country. And so that's why we end up, I think, having to look at Japan and Germany as models. And I think it's interesting that in both cases, the new taxes that have been introduced have been accepted by the public in those countries as being necessary.
Jeremy, I want to just come to Sarah Wotton, if I can, because you made a point in the chat, which I guess goes to something which is not policy, it's not politics, it's about culture and about how we come to think differently about life and sickness and death. And Sarah, I wondered, you made this point about how this might change us culturally. Do you want to put the point to Jeremy?
Yes, thank you. Hello, hi Jeremy. My interest in it is how people have died during the pandemic and how we can have another 1948 moment and change how people die in the future. I think the pandemic has really stressed the cracks in what was already a deficient system. Decisions have been made for people, without taking their wishes into account. There were blanket decisions. We've had a real problem because we don't have a culture of people talking about normalizing the fact that we're all going to die and making plans for that. So I think we do need to change the culture around this, and we need to put decision making in people's hands. I mean, I'm the chief executive of Dignity in Dying, so I would say this, but I think we need to legalise assisted dying. I think we need to listen to what people are saying, that we need to stop the traipsing off to Switzerland and One Britain every week. But critically, we need to listen to what patients want at the end of life. What do you think?
Well, I mean, it's a massively difficult issue, but regardless of the different views people will have about assisted dying, I think that everyone can stand squarely behind what you've just said, which is the importance of everyone thinking about how they would like to die. And maybe this pandemic can be a moment when this happens. And we know, and I remember from my time as health secretary, how immensely positive it was in Bath, for example, where they ran an experiment where they consciously reached out to all the older people that were being looked after in one part of Bath and made a point of explicitly asking them how they wanted to die. And some of them, particularly ones in care homes, some of them said they did not want to be taken to hospital if took a turn for the worse. They wanted to just die peacefully in the care home. And others said they would want to go to hospital at any cost. And it wasn't the people you expected who would necessarily say the one or the other. But the result of having those early conversations, which has to really happen between a GP or a nurse and a patient, is that the NHS can look after people so much better because we understand what it is they really want before the crisis happens. And we are now just moving to one of the other benefits that Simon was talking about. The use of electronic medical records has been phenomenal during COVID. I think if everyone's electronic medical record that can now be shared around the system in a way that hasn't been possible before had their end of life preferences, that would be an amazing step forward to giving people more control over their own destiny.
Jeremy, thank you. And Sarah, thank you very much. Jeremy, can I ask you, I think at this stage in a conversation like this, we've got a couple of minutes left. I usually now would try and sneak in a question about, are you headed back to the cabinet in a reshuffle? Or, do you think you'll have another run at the leadership of the Conservative Party? I tell you, I'm going to ask that question in a slightly different way, which is this. How do you balance being the chair of the Health Select Committee and in one of the very few seats where you can properly scrutinize the conduct of the government at a time when its conduct has mattered more to us than at any time in my lifetime, that you can properly be independent. You can really call out failures that are in public service or in the hands of politicians, and at the same time be alive to the fact that, of course, somewhere in your calculation must be, I shouldn't push this too far because sooner or later I might want to go back into the cabinet. I might want to sit around the table with these people. Heaven knows I might need their support if I take another run at the leadership. How do you balance the moment you're in now and the possibilities that might come in the future?
Well, very finely calibrated question, James. But I hope you've seen, and everyone's seen over the last year, that I've been completely willing to speak truth to power, irrespective of the impact it might have on me personally. I have focused on just telling the truth. I mean, last year I thought we should have locked down earlier. I thought we should have been doing South Korean test and trace. Even in January, I thought we should have closed the schools and borders, and I said so publicly before the government decided to do exactly that. So you can't be chair of a select committee unless you're prepared to be absolutely straight about what you believe needs to happen, because that is the great privilege of that position. But the reason I took this job was because when I was health secretary, I'm sure I didn't get everything right, but the one thing I really focused on was what's known in the medical world as patient safety. My real concern about the high number of avoidable deaths and avoidable harm in modern healthcare systems, not just the NHS, but around the world. And the fact that I think we need to change the culture in medicine to reduce what in the NHS, we know that in normal times outside of pandemic, it's about 150 avoidable deaths every week. And we've really got to change our culture to prevent those tragedies happening. And that was something that I spent my time focusing on, and I wanted to carry on doing that in this parliament. And I thought being chair of the Health Select Committee would be a very good way to do that. I'm writing a book on it as well, and all sorts of things. So my motivation is to do that and to do it properly. In terms of the future, well, I don't rule out going back. I have found being out of government a lot more pleasurable than I thought, and I found my ambitions slightly ebbing away a bit as a result of that. And I do enjoy being able to speak honestly about the issues of the day. But obviously, I don't know what's going to happen in the future in politics. That's the joy, I suppose. You never do.
Jeremy Hunt, thank you very much for joining us. Thank you, everyone, actually, for making the time to be with us this evening. I'm sure lots of people will take different things away, Jeremy, from listening to you for an hour, not least quite impressed that with COVID and happily on the mend from that you're able to conduct a conversation like this. But I should just say one thing that I didn't expect to hear, and I will really think about a lot, is this need for a greater access to real-time information, not just so the public's informed, but so the quality of information that government gets is scrutinised, and this access to information so that the government itself is encouraged to make good decisions on its workforce in the NHS. And I think a call on all of us to have, and it is on all of us, to have an honest conversation about what's working and what's not. They're all, welcome and large things to think about. So we can't give you a drink or even a round of applause, but we can say thank you for sparing the time and wave you off with a smile. Thank you very much, Jeremy Hunt.
Thank you, James, very much indeed.